I am Dr. Rajasekhar from Chirag Global Hospitals JP Nagar 2nd Phase, Bangalore. I am a practicing proctologist and colorectal surgeon for the past 25 years, and I am also a general surgeon for the past 35 years. There are basically three major diseases which affect the anal canal and rectum, benign diseases apart from cancers. So they are all classified as piles, fissure, fistula. These are the common diseases which affect the anal canal and rectum. For the common man, they think everything is piles. So let me explain each one of them. They are all three different diseases occurring in the same area. So patients think it is piles. So let me talk about piles first. Piles are nothing but three bunches of blood vessels which are there in the anal canal about 2 centimeters inside, and they act like valves to prevent escape of air and all. So they are called anal cushions. Everybody has it. When more blood flows into that, because of prolonged sitting, straining a stool, or very spicy food which will irritate that area, pregnancy, lifting of heavy weights, intra-abdominal pressure, all this will cause increased flow into these anal cushions, and when they enlarge, we call them as piles. So in that there are 4 stages. Stage 1, it is there inside, not seen from outside, but occasionally bleeding. Stage 2 is, it is a little bigger, and then when they apply pressure, something comes out and goes back. Third stage, it comes out, one has to push it back. Fourth stage, it remains outside. These are all the internal piles. Similar structures, if they enlarge outside, we call it as external piles. So piles are nothing but vascular issues where there is bleeding or there is swelling. Usually in piles there won't be pain. If there is pain in piles, it is more because of the complication like a thrombosed pile where blood gets clotted causing pain. Otherwise piles cause either bleeding or swelling. That's a different disease. The other one is called fissure. Fissure is nothing but a cut in the anal canal. So what happens if there are 2 muscles called sphincters which will be keeping the anal canal closed in normal situations, and when we want to pass stools, it has to open. So instead of open completely, it opens only partially for some people. That is known as anal sphincteric spasm. So that time if the motions are hard, when it is coming out, it will tear and come out. The tear is called fissure. It's a small cut, it's a small wound. That is called fissure. There are different varieties of treatment. Usually we treat the beginning stages of fissures with medical management which will respond to that. If it is recurring or if it is chronic, then we will do certain surgical procedures including lasers and all we use for that. So that's again a different disease. Third is called fistula. Fistula is an infective condition. There are something called anal glands between the sphincters which will be secreting a little secretions into the anal canal. So when the motion enters into it or they get damaged due to some friction and all that, then there will be a collection of pus. So it is called abscess. Then if it is opened inside, we call it as a sinus. If it spreads and comes out and bursts open, we call it as a fistula. So basically fistula will have 1 or 2 openings outside the anal canal where pus will be coming out. There will be 1 or 2 or many internal openings. Usually it will be 1, sometimes it will be more. And those will be connected through small tracts. The whole, this one is called as fistula. So in fistula, usually it is only surgical treatment, medicines will not work. Some of the fistulas can be because of some other reasons like tuberculosis, Crohn's disease, where we treat medically also. So fistula is a different disease, fissure is different, piles are different diseases.